Hello, my name is Mayra Rosero. I'm studying in the Catholic University Santiago from Guayaquil from the nursing career. My topic from today is the nasal deformity in granulomatosis with polyangiitis. What is a nasal deformity in granulomatosis with polyangiitis? Definition. Granulomatosis with polyangiitis is a multisystem inflammatory disease characterized by a small to medium vessel vasculature with necrotizing granuloma formation. This is a common disease of unknown etiology. Clinical involves the ELK, dry of the ear, nose, throat, lungs, and kidneys, with necrotizing granulomatous inflammation and vasculitis.
With polyangiitis, or GPA, formerly known as Wegener's granulomatosis. The learning objectives for this talk. In the next 10 minutes, we're going to cover the classification criteria for GPA, learn to identify clinical signs and symptoms, which would raise your level of suspicion for GPA, review other diseases considered in the differential diagnosis for GPA, and discuss the labs and studies which help to rule in or rule out this diagnosis. As I covered in the learning objectives, we'll start with the clinical presentation and diagnosis. We will then move on to the treatment of GPA and summarize all that we have covered. Granulomatosis with polyangiitis. This disease was formerly known as Wegener's. The name was recently changed from the eponym to a more descriptive title. It is a systemic vasculitis, which means that it can affect multiple organ systems. We will talk about the organs most involved as we move through the review. GPA is a vasculitis, which means inflammation of the blood vessel walls, and small and medium-sized arteries are targeted in this process. GPA is one of the ANCA-associated vasculitides, meaning anti-neutrophil cytoplasmic antibodies are detected in this disease. Often, the upper and lower respiratory tract are involved, as well as the kidneys, making GPA one of the known pulmonary renal syndromes. Although we will see as we go further that other organ systems can be involved as well. The clinical presentation of GPA classically occurs in ages 30 to 50, although it can range from children as young as 5 years to the elderly. It is a rare disease, and the incidence of GPA is 15.6 cases per million people in the United States. The prevalence of this disease is 123 cases per million. Since it is a systemic autoimmune disease, fever, malaise, weight loss, and fatigue are often seen. In addition to the systemic symptoms, the upper respiratory tract is targeted quite frequently. Upper respiratory involvement can present as recurrent epistaxis or nosebleeds.
Application in nursing. Most of the initial symptoms begin in the head and neck region, with a wide spectrum of involvement of any side ranging from the nasal septum, paranasal, sinus, oral mucus, larynx, and even the external, middle, and internal ear. The onset of granulomatosis with polyangiitis can be insidious or acute. The full spectrum of the disease may appear after several years. Cons: non-specific chronic inflammation and tissue necrosis occurs in the nose. In the lungs, the full spectrum of the pathological abnormalities can be seen. Issue applying in Ecuador. The GW is a disease that predominates in the middle age of life and preferably affect males. In Ecuador, an incidence of 8.5 a 1 million of inhabitants year and prevalence of 3 times 100,000 people have been reported. Renal commitment is frequent, reaching up to 80% of patients. Conclusion: granulomatosis with polyangiitis is a systematic vasculitis of the small glands, which most frequently affect the respiratory tract and kidney. Its diagnostic criteria are based on the clinic. It is a potential serious disease. However, with an early diagnosis, granulomatosis with polyangiitis can be treated effectively.
Anti-neutrophilic cytoplasmic antibody-associated vasculitis, or ANCA-associated vasculitis for short, is a type of vasculitis that affects small blood vessels, and they include 3 diseases and are characterized by the presence of the ANCA antibodies. These 3 conditions are granulomatosis with polyangiitis, microscopic polyangiitis, and eosinophilic granulomatosis with polyangiitis. Some of these can lead to a complication called ANCA nephritis or ANCA-associated glomerulonephritis. There are 2 types of antibodies found in ANCA. These include the p-ANCA, which are antibodies directed against neutrophil enzyme myeloperoxidase. The P is for perinuclear, and then the second antibody is c-ANCA, the C for cytoplasmic, and these antibodies are directed against the neutrophil proteinase 3. ANCA may play a direct role in vessel damage by hyperactivating already primed neutrophils, leading to vessel endothelial inflammation and damage. The presence of In this video, we're going to mainly focus on granulomatosis with polyangiitis, also known as Wegener's syndrome. And Wegener's syndrome is the most common ANCA-associated vasculitis, and more than 95% of patients are ANCA positive against proteinase 3. It is a small vessel vasculitis characterized by inflammation of the small blood vessels with infiltration of immune cells forming granulomas. The granulomas are formed by T cells and other immune cells. Granulomatous inflammation occurs in the blood vessels of the upper respiratory tract, lower respiratory tract, and kidneys in granulomatosis with polyangiitis. And this is the Wegener's triad: upper respiratory tract, lower respiratory tract, and renal tract involvement. Granulomatosis with polyangiitis is the most prevalent of the ANCA-associated vasculitis, with a mean age of onset of 40, but really can occur at any age. It occurs in females and males equally. Histopathological findings include granuloma formation, as mentioned, but also palsy immune necrotizing vasculitis of the small arteries and also the small